Hi everyone, my name is Jennifer Murdoch. This is my presentation on polypharmacy. What is polypharmacy? Polypharmacy is using multiple drugs at once, including prescribed, over-the-counter, and supplements. There is not an agreed upon consensus for how many drugs that entails, but the literature seems to agree on it being 5 or more medications. Using 10 or more drugs is considered excessive polypharmacy. Polypharmacy includes prescribing drugs that are inappropriate. Inappropriate prescribing may be when a provider is trying to treat the side effects of another medication. Another example of polypharmacy includes when a patient is on a medication and that was started at a low dose for safety reasons, but the drug was not increased, and now the drug is subtherapeutic, and another drug is added for the initial condition without changing the dose or discontinuing the first medication. Evidence-based guidelines for treatment have resulted in providers prescribing medications in order to meet the expectations of insurance companies and outcome-based mandates. This has resulted in treating only the condition without considering the patient's wants, needs, or goals. Older adults are the largest group of people who take medication. They have many comorbidities, and 39% of older adults take 5 or more medications. Most of these are antidepressants and cardioprotective drugs. Older adults are also more likely to be impacted by side effects of medications, as well as drug interactions because of the number of comorbid conditions they have. This can result in decreased medication adherence. So many times patients will come into the primary care setting and decide they don't want to take a certain medication that they were prescribed because they weren't happy with the side effect or felt that the drug wasn't working, and oftentimes they just stop taking the medication. Polypharmacy is linked to a decline in physical condition, cognitive function, and nutritional status. Decreased ability to perform IADLs can become a problem related to polypharmacy. Sarcopenia, or loss of muscle mass, can also be attributed to polypharmacy, which can lead to frailty and hospitalization. There is also a connection between multimorbidity and polypharmacy. These issues can lead to depression in the older adult and result in a decline in quality of life. Increased falls are often a result of being on multiple medications, and 10% of all ED visits and 17% of hospital admissions are related to adverse drug reactions. These multiple hospital readmissions also lead to increased cost. The nurse practitioner implications in polypharmacy in the older adult include the Beers criteria. The Beers criteria was developed to assist clinicians and others in lessening the use of potentially inappropriate medications in those over age 65. It is designed to provide guidance on medications that should not be used in the older adult. The list is categorized by drug class, with medications in the class listed, as well as by diagnosis. It also provides recommendations about the specific medications and the quality of the evidence that was used to make the decision about a certain medication. It is important to note that the Beers criteria is not utilized in palliative or hospice patients. Stop-start are also tools that can be used to avoid prescribing potentially inappropriate medications. The STOP tool lists medications that may cause adverse drug reactions that lead to hospitalization. The START tool is used in conjunction with STOP to make prescribers aware of medications that are used for certain conditions but may be omitted. Deprescribing involves working with the patient and their family to determine if a current medication is still necessary, and if so, is the current dose appropriate. It also entails a plan to either remove the medication or lower the dose safely. An instance of this would be when a medication is no longer effective, or the risk outweighs the benefit of a medication, or when a patient is transferring to hospice. When patients have a new concern or chief complaint, the nurse practitioner must review the current medications to ensure a new drug is not being prescribed to treat a side effect of a current medication, as well as ensuring duplicate therapy does not occur. It is important for the nurse practitioner to consider the changes in the older adult that impact the pharmacokinetics of a drug. Absorption can be impacted by the decreased acid in the stomach as well as slowed digestion. The distribution of a medication is affected by hydration status, lean body mass, and nutrition status. An example is medication that is highly protein bound. In patients with lower body mass, they don't have as many receptor sites and a lower amount of albumin for binding that leads to more free drug availability because of higher concentration of the drug in plasma. An example of a highly protein-bound medication is Coumadin. It is important for the nurse practitioner to provide education about the medication being prescribed, including its use, side effects, potential cost, and what the goal of treatment is. Depending on the medication ordered, follow-up is necessary within a certain time frame to determine how the patient is tolerating the medication as well as the medication effectiveness. This is also a good time to review if the patient is truly taking the medication every day and if they are experiencing side effects and perhaps are not taking the medication as it was prescribed. It's an opportunity to educate the patient about the medication and reinforce the role of the medication in treating the condition. We need to be mindful of patients when they decide they don't want to take another medication. It is essential to have honest conversations with patients about their conditions and the medications used to treat them. These conversations need to include the risk and benefits of medications as well as side effects and potential drug interactions. Patients need to be able to make informed decisions about their health, and nurse practitioners are in a pivotal role to provide education and support patients. Thank you.